Dementia. Dementia is a broad category of brain diseases that cause a long-term and often gradual decrease in the ability to think and remember that is great enough to affect a person's daily functioning. Other common symptoms include emotional problems, problems with language, and a decrease in motivation. A person's consciousness is usually not affected. A dementia diagnosis requires a change from a person's usual mental functioning and a greater decline than one would expect due to aging. These diseases also have a significant effect on a person's caregivers. The most common type of dementia is Alzheimer's disease, which makes up 50% to 70% of cases. Other common types include vascular dementia, 25%, Lewy body dementia, 15%, and frontotemporal dementia, according to the encyclopedia. Less common causes include normal pressure, hydrocephalus, Parkinson's disease, syphilis, and Creutzfeldt-Jakob disease, among others. More than one type of dementia may exist in the same person. A small portion of cases run in families. In the DSM-5, dementia was reclassified as a neurocognitive disorder with various degrees of severity. Diagnosis is usually based on history of the illness and cognitive testing with medical imaging and blood work used to rule out other possible causes. The mini-mental state examination is one commonly used cognitive test. Efforts to prevent dementia include trying to decrease risk factors such as high blood pressure, smoking, diabetes, and obesity. Screening the general population for the disorder is not recommended. There is no known cure for dementia, according to the encyclopedia. Cholinesterase inhibitors such as donepezil are often used and may be beneficial in mild to moderate disorder. Overall benefit, however, may be minor. There are many measures that can improve the quality of life of people with dementia and their caregivers. Cognitive and behavioral interventions may be appropriate. Educating and providing emotional support to the caregiver is important. Exercise programs may be beneficial with respect to activities of daily living and potentially improve outcomes. Treatment of behavioral problems with antipsychotics is common, but not usually recommended due to the little benefit and side effects, including an increased risk of death. Globally, dementia affected about 46 million people in 2015. About 10% of people develop the disorder at some point in their lives. It becomes more common with age. About 3% of people between the ages of 65 to 74 have dementia, 19% between 75 and 84, and nearly half of those over 85 years of age. In 2013, dementia resulted in about 1.7 million deaths, up from 0.8 million in 1990. As more people are living longer, dementia is becoming more common in the population as a whole. For people of a specific age, however, it may be becoming less frequent, at least in the developing world, due to a decrease in risk factors. It is one of the most common causes of disability among the old. It is believed to result in economic costs of $604 billion a year. People with dementia are often physically or chemically restrained to a greater degree than necessary, raising issues of human rights. Social stigma against those affected is common. Read about the signs and symptoms of dementia. Mild cognitive impairment, early stages, middle stages, late stages. Causes of dementia. Reversible causes, Alzheimer's disease, vascular dementia, dementia in Lewy bodies, frontotemporal dementia, progressive supranuclear palsy, corticobasal degeneration, rapidly progressive dementia, immunologically mediated dementia, other conditions, mild cognitive impairment, fixed cognitive impairment, slowly progressive, diagnosis, cognitive testing, laboratory tests, imaging, prevention, management, psychological therapies, medications, pain, eating difficulties, alternative medicine, palliative care, the epidemiology, the history of dementia, society and culture. Read all about dementia, dementia, dementia.